It's almost unbelievable, but mammary tumors are the third most common cancer diagnosed in our cats. Third most common. That really hit me. It makes you realize how important it is for us cat lovers to get a handle on this.
It absolutely does, and that's exactly what we're diving into today. We've got a really detailed medical article here about feline mammary gland tumors, and our goal is to pull out the crucial stuff. We'll give you a clear picture of what this condition is all about, from how often it happens to what the current approaches are for treatment.
Okay, so think of this as your fast track to understanding feline mammary tumors, no complicated jargon, just the key information you need. Okay, let's unpack this, starting with the basics. When we talk about mammary gland tumors in cats, what exactly are we looking at?
Essentially, we're talking about abnormal growths in the mammary glands of cats. Now, these can be either benign, meaning they're not cancerous, or malignant, which means they are cancerous. But what's really striking here is just how often these tumors in cats turn out to be the malignant kind,
Really often, you mean? How often are we talking?
alarmingly often. The article points out that a massive 85 to 95% of mammary tumors in cats are malignant, and most of those are a type of cancer called carcinomas. Benign tumors, the non-cancerous ones, are actually quite rare, only making up about 5 to 15%. It's also worth mentioning there are rarer, more aggressive types like sarcomas and inflammatory carcinomas. While not as common, these are important to know about because they can spread very quickly. This stark statistic really underscores the importance of proactive care and, not just dismissing any changes you might find.
Wow, okay. So when we're talking about feline mammary tumors, we're usually facing a serious, potentially fast-moving cancer. And it sounds like the spread of this cancer is a major concern, too.
It is indeed. Metastasis, which is when the cancer spreads to other parts of the body, is very common with these tumors. The lungs are a frequent target. Pulmonary metastasis, that's cancer spread to the lungs, occurs in up to 80% of cats. That's huge.
80%. Yeah.
And the regional lymph nodes, the ones nearby, are also commonly affected, maybe in as many as 50% of cases.
That's a really high number, too. Are there other places where these tumors tend to spread?
Yes, the article lists quite a few, actually. Besides the lungs and lymph nodes, metastasis can happen in organs like the liver, spleen, kidneys, even the adrenal glands. It can also spread to the pleura and peritoneum. Those are linings in the chest and abdomen. Also the heart, thyroid gland, and even bone. In fact, studies done after a cat has passed away, necropsies, have shown metastasis in over 90% of cats with these tumors, which really highlights how prone this cancer is to spreading.
That paints a pretty sobering picture. And the article mentions something about spreading through the lymph system and creating beaded chains. What's that?
Yeah, that's a distinctive way this cancer can sometimes spread. Imagine tiny channels throughout the mammary tissue. Those are the lymphatics. Sometimes, as the tumor cells travel through these channels, they can get stuck and form little lumps you might actually feel under the skin, creating that sort of beaded chain effect along the tissue.
Okay, that gives us a clearer idea of what these tumors are and how they can behave. Now, who are we talking about when we say cats affected by this? Is it something that affects all cats equally?
Not exactly. I mean, it only occurs in cats, obviously, but there are some patterns. Domestic short-hair and long-hair cats are diagnosed most often, but the article suggests this is probably just because there are, well, more of them around. Population size.
Right, makes sense.
Interestingly, though, Siamese cats are noted to have twice the risk compared to other breeds.
Twice the risk. That's quite a difference.
It is. It definitely raises questions about specific genes involved, maybe future targeted therapies, though right now that's still in the research phase.
What about age? When do we tend to see these tumors crop up?
The average age when cats are diagnosed is around 10 to 12 years old, but these tumors can appear across a really wide range from as young as 9 months up to a very old 23 years.
Wow, 9 months to 23 years. That's huge variability.
It is. And interestingly, Siamese cats, again, they tend to develop these tumors at a younger age. It seems the number of cases in Siamese kind of plateaus around 9 years old.
And what about whether the cat is male or female? Is there a bias there?
Oh yes, definitely. There's a strong tendency for this to occur in female cats. The vast majority of feline mammary tumors happen in females. However, it's important to remember that male cats can also get them. It's much less common, though, maybe accounting for about 1 to 5% of cases.
Only 1 to 5% in males.
Okay.
And interestingly, even though spaying significantly reduces the risk, the article points out that most cats diagnosed with mammary tumors are actually already spayed when they're diagnosed. which seems counterintuitive, but we'll get to that.
Right, that brings us straight to what increases a cat's chances of getting these tumors, the risk factors. We know spaying is important, but let's dig into that timing aspect more. What exactly does the data tell us about when a cat is spayed? This is a really key point. The article highlights that spaying before 6 months of age provides a really significant protective effect. It reduces the risk of developing mammary carcinomas by 11 times compared to cats who aren't spayed.
11 times.
Yeah, 11 times. Spaying between 6 and 12 months also gives good protection, reducing the risk by about 7 times. But, and this is crucial, it seems there's no real protective benefit if a cat is spayed after 12 months of age.
After 1 year, no benefit.
Essentially, yes.
Huh.
It strongly suggests that the hormonal influence on how the mammary tissue develops is most critical during those first 6 to 12 months.
That's incredible. If you're considering spaying your kitten, that's a massive difference to know about. What about other hormone-related things? The article mentions something about progestins.
Yes, exposure to exogenous progestins. These are synthetic hormones, sometimes used in cats for various, medical reasons, has been shown to increase the risk of both benign and malignant mammary tumors. And that's in both female and male cats. The article even mentions a study where a noticeable number of male cats diagnosed with these tumors had a history of receiving progestin therapy.
So another clear link to hormones there. What about something like how many litters a female cat has had? Does that make a difference? Parity, I think it's called.
Interestingly, no. The article says that parity, the number of litters a cat has had, hasn't actually been shown to affect whether they develop mammary tumors.
Huh, okay. And we touched on Siamese cats having a higher risk, which suggests genetics might play a role.
It certainly does suggest that. The higher rate in Siamese cats strongly points towards a genetic component to this disease. However, the specific genes involved haven't been identified yet. This is definitely an area where future research could give us some really valuable insights.
Okay, so we've got age, sex, breed in the case of Siamese, and very clearly the timing of spaying and exposure to certain hormones as important factors. Let's move on to what cat owners might actually see the signs. What are some things that should make them, pay attention?
Right. The most common thing owners will notice first is usually a lump, something they can feel on the underside of their cat's abdomen along the mammary chains. These lumps can vary quite a bit in size and how they feel.
And what about other signs, especially if it's more advanced?
In more advanced cases, cats might show general signs of being unwell, like being tired, lethargic, or maybe not eating as much. If the cancer has spread, you might see signs related to the specific organs affected. For example, if it's spread to the lungs, they might have trouble breathing, or there could be fluid buildup in the chest cavity that's called pleural effusion.
And what might these lumps actually feel like when you examine them?
They can feel quite different. They might be well-defined, like a distinct little nodule, or they might feel more infiltrative, like they're blending into the surrounding tissue. They could be soft or quite firm. Smaller lumps might move around easily under the skin, whereas larger ones might feel stuck, adhered to the deeper tissues.
Does the skin over them change?
It can. The skin might look totally normal, but it's also pretty common to see it become ulcerated, like an open sore. Sometimes the nipple near the affected gland might look red and inflamed and could even leak a watery fluid.
And are there certain areas along those mammary chains where these tumors are more likely to pop up?
Yes, while any of the mammary glands can be affected, the ones further back, the caudal glands towards the tail end of the cat, seem to be more commonly involved. Interestingly, it seems to happen on the left and right sides about equally often.
Okay. And can cats have more than one?
Oh, definitely. It's important to know that up to half of cats with mammary tumors will actually have more than one tumor, either in different glands on the same side or sometimes on both sides of their body.
Multiple tumors. That's a sobering thought. What about the lymph nodes nearby? Do they often get involved visibly?
Yes, the lymph nodes in the armpit area, the axillary nodes, or in the groin area, the inguinal nodes, can become enlarged. Now, this could just be a reaction to inflammation, but it could also mean the cancer has spread to those nodes.
Right.
And as we mentioned before, the cancer can also spread through the lymph vessels within the mammary tissue itself, sometimes creating that line of small lumps, that beaded chain effect we talked about.
You mentioned inflammatory carcinoma earlier as a rarer type. Are there specific signs that might suggest that more aggressive form?
Yes, inflammatory carcinoma tends to present with more severe and sudden signs. You might see significant open sores, ulceration, redness of the skin, obvious pain, and quite a bit of swelling on the underside of the cat. This can even extend down into their back legs sometimes.
Okay, these are definitely things that cat owners need to be aware of and report to their vet right away. So, if a vet suspects a mammary tumor, what's the process for figuring out exactly what it is? What other things might it be confused with?
Right, the first step is differential diagnosis, ruling out other conditions that can look similar. In younger female cats who haven't been spayed, or maybe those given progestins, a benign overgrowth of mammary tissue called fibroepithelial hyperplasia is a key one to consider.
Okay.
Other possibilities include mastitis, which is an infection or inflammation of the glands, other types of lumps under the skin like lipomas, maybe enlarged lymph nodes due to infection or other cancers, hernias, and even just a prominent pad of fat in the groin area can sometimes be confusing.
And what about initial tests like blood work or urine sample? Do those give clues?
Generally, routine blood tests, CBC, biochemistry, and urinalysis are usually, well, unremarkable in cats with mammary tumors, unless, of course, there are other health issues going on at the same time.
But the article did mention something about checking blood clotting in certain situations.
Yes, that's important. If inflammatory carcinoma is suspected because it's so aggressive, it's a good idea to run a coagulation profile. That checks how well the blood clots. This is because those specific tumors have a higher risk of causing a serious condition called DIC, disseminated intravascular coagulopathy, where the body starts forming blood clots inappropriately.
Got it. What about using imaging like x-rays or ultrasound? What role do they play?
Imaging is really important, mainly for staging, seeing if the cancer has spread. Chest x-rays, usually 3 views, are recommended to check for pulmonary metastasis, that cancer in the lungs we talked about, and also to see if there's fluid buildup in the chest, the pleural effusion.
What does lung metastasis look like on an x-ray?
It can vary. Often it looks like hazy spots or maybe a more widespread sort of interstitial pattern in the lung tissue. Sometimes they can be more distinct nodules, though, and fluid in the chest can obviously make it harder to see the lungs clearly.
An ultrasound.
An abdominal ultrasound is useful, too. It helps to examine the lymph nodes inside the abdomen, like the medial iliac nodes and other abdominal organs, liver, spleen, for any signs of spread. It can also sometimes help find lymph nodes in the armpit and groin areas that might not be easily felt, and maybe even find other small tumors within the mammary glands themselves that weren't obvious on palpation.
So imaging helps stage the cancer, see if it's spread. But how do vets actually confirm if a lump is cancerous and what specific type it is? The article mentions cytology and histopathology. Can you break those down?
Sure, cytology involves taking a sample of cells, often with a fine needle aspirate, and looking at them under a microscope. It can be helpful for ruling out other types of cancer, like maybe a mast cell tumor that just happens to be in that area. However, it's generally not very reliable for telling the difference between benign and malignant mammary tumors. They can look quite similar at the cellular level sometimes.
So cytology isn't the final answer usually?
Not for mammary tumors, no. Histopathology, on the other hand, is really the gold standard. This means examining a piece of the actual tissue architecture. This usually involves taking a tissue sample through surgery, either removing the whole lump or sometimes just a piece if surgery isn't immediately planned, and sending it to a pathologist.
So that's how you get the definitive diagnosis.
Exactly. Histopathology is essential. It confirms if it's cancer, what type it is, and also determines the grade of the tumor that's based on things like how much the cells look like normal gland cells, how different they are, and how quickly they seem to be dividing. Crucially, the pathologist also looks at the edges of the removed tissue, the margins, to see if any cancer cells were left behind.
And the lymph nodes.
Yes, any draining lymph nodes, like the inguinal or axillary, should ideally be removed during surgery and examined by the pathologist too, even if they look or feel normal, because microscopic spread is common.
Okay, so surgery is often key for diagnosis too. Let's talk more about treatment options then. The article clearly points to surgery as the main approach. What kind of surgery are we talking about?
Right. The generally recommended surgery is a radical mastectomy of the affected mammary chain, or sometimes both chains if needed. This means removing all the mammary glands on the affected side from front to back. The reason is that this significantly lowers the chance of the tumor coming back locally in the same area and reduces the risk of it spreading through those lymphatic vessels within the mammary tissue.
All the glands on one side. Wow. What if both sides have tumors?
If both sides have tumors, the surgeries are usually staged, meaning they're done separately, typically a couple of weeks apart, to allow for healing. Although it's worth noting, some research suggests that maybe removing just the affected chain might be enough for local control in some cases, but radical mastectomy is still often preferred due to the interconnected lymphatics.
And the lymph nodes get removed too.
Yes, ideally the lymph nodes in the groin, the inguinal nodes, and if possible, the axillary nodes in the armpit on the affected side should be removed at the same time, even if they don't look or feel enlarged, for that staging reason we discussed.
What about cases where a cure isn't likely?
In cases where the cancer has already spread significantly and a cure isn't the goal, a more limited palliative surgery might be done. This might just involve removing a primary tumor that's ulcerated or infected, mainly to make the cat more comfortable.
Okay, surgery sounds like the main local treatment. But given how often you've said this cancer spreads, what about other treatments, like chemotherapy?
That's a very important point. Because there's such a high chance of metastasis, adjuvant chemotherapy, that's chemo given after surgery, is generally recommended. Usually started once the cat has recovered well from the surgery.
What kind of chemo drugs are used?
Some of the drugs mentioned in the article are doxorubicin, sometimes used by itself, or perhaps combined with cyclophosphamide. There are other protocols too, and it's always best to consult with a veterinary oncologist for the most current recommendations based on the specific case.
And what if surgery isn't an option at all? Can chemo be used alone?
Yes, if surgery isn't possible, maybe the cancer is too widespread already, or the cat has other serious health issues. Chemotherapy can be used as the main or sole treatment. However, it's less likely to provide long-term control in those situations compared to surgery followed by chemo.
What about radiation?
Radiation therapy hasn't really been well evaluated or widely used for feline mammary tumors, according to this source.
Okay. And for cats where the cancer is very advanced and maybe aggressive treatments aren't the right choice, what kind of supportive care can be provided?
Palliative care becomes the focus then. It's all about managing symptoms and maximizing the cat's quality of life. For cats with tumors that can't be removed or where the cancer has spread widely, pain management is really important. Antibiotics might also be needed if the tumors are ulcerated or infected to keep them comfortable.
So the treatment plan really depends heavily on how advanced the cancer is when it's found. Let's talk about what owners can expect in terms of outlook, the prognosis. The article mentions tumor size being a huge factor.
Yes, absolutely. The size of the largest tumor at the time of diagnosis is a major prognostic indicator. It significantly impacts survival time. The article gives some specific median survival times based on the tumor diameter. For tumors that are 2 centimeters or smaller, the median survival time is actually quite good, reported as over 4.5 years.
Over 4.5 years for small ones. That's encouraging.
It is, although it notes it tends to be shorter in male cats, maybe around 14 months even for smaller tumors.
Okay. And for larger tumors?
For tumors between 2 and 3 centimeters, the median survival drops quite a bit, maybe 1 to 2 years in females, and only about 5 to 6 months in males.
Wow, quite a drop. And bigger than 3 centimeters.
And for tumors larger than 3 centimeters, that outlook is considerably worse. The average survival is just 4 to 6 months in females and only 1 to 2 months in males.
Oof. Those numbers really highlight the importance of catching these things when they are small.
Precisely. Early detection is absolutely critical for a better prognosis.
What about how surgery and chemotherapy affect the prognosis overall?
Well, as we said, radical mastectomy significantly reduces the risk of the tumor coming back locally. However, its impact on overall survival time isn't always as clear-cut in all studies, likely because metastasis spread elsewhere is such a common cause of death. Adjuvant chemotherapy has been studied a lot. And while results vary between studies, some show a clear survival benefit, others are less conclusive. It's still generally recommended because of that high risk of microscopic spread that's already happened by the time of surgery.
Does chemo work well if the cancer has already visibly spread?
Chemotherapy has been shown to have activity against tumors that can't be surgically removed or those that have metastasized. Roughly half of cats might show some response to it. For cats that do respond to chemotherapy in the face of advanced disease, survival times might range from, say, 6 to 12 months, whereas those whose cancer doesn't respond tend to survive for less than 6 months, unfortunately.
It sounds like it can be a very challenging disease once it has spread significantly, which brings us right back around to prevention. We've already talked about early spaying, but can you just emphasize again how much of a difference that makes?
Absolutely. I can't stress this enough. Having a female cat spade the ovariohysterectomy before she is 6 months old can reduce her risk of developing mammary carcinoma by that astounding 11 times. It's a truly powerful preventative measure for female cats who aren't going to be used for breeding.
11 times. That's just such a compelling statistic. So, for cat owners listening, what are the main takeaways? What should they be doing?
Client education is just so vital here. We really need to emphasize the strong benefits of early spaying before 6 months for female cats not intended for breeding. Owners also need to be vigilant. Get used to checking your cat's underside regularly. Feel for any new lumps or bumps in the mammary area, and understand the importance of getting them checked out by a vet promptly. Don't wait and see.
Right.
If a tumor is found, early and aggressive treatment, usually involving surgery, really does give the best chance for a positive outcome.
And once a cat has been treated for a mammary tumor, what does the ongoing care usually involve? What's the follow-up like?
Regular checkups are essential. The article suggests thorough physical exams, maybe monthly for the first 3 months after treatment, and then perhaps every 2 to 3 months after that. During these exams, the vet will carefully check the surgical site, palpate the remaining mammary glands, and check those nearby lymph nodes again.
And imaging.
Yes. It's also typically recommended to perform chest x-rays regularly, perhaps every 2 to 3 months, specifically to monitor for any signs of the cancer spreading to the lungs, that pulmonary metastasis.
Okay. This has been a really thorough and honestly quite eye-opening overview. Let's just quickly recap the most crucial points before we wrap up.
Absolutely. So, to sum up, feline mammary tumors are very often malignant, a high percentage. They have a strong tendency to metastasize or spread, especially to the lungs and lymph nodes. Hormones play a significant role, underscored by the dramatic protection offered by spaying before 6 months of age. Finding any lumps early and pursuing aggressive treatment, primarily surgery, is really critical for improving the outcome.
Yeah.
And remember, the size of the tumor when it's diagnosed is a major factor in predicting the prognosis. Smaller is definitely better.
And ultimately, being observant, knowing what's normal for your cat, and getting in touch with your veterinarian quickly if you notice anything unusual with your cat's mammary glands is really the best course of action.
Exactly. Being proactive and informed is the best way we can support the health of our feline companions when it comes to this condition.
This has been incredibly insightful. Thank you. Now, for a final thought for everyone listening, considering that really strong link between hormones and feline mammary tumors and the clear impact of early spaying, it really makes you wonder, doesn't it? What other aspects of feline health might be significantly influenced by their reproductive status and perhaps the timing of interventions like spaying or neutering? It's definitely something interesting to think about as we continue to learn more about keeping our cats healthy for as long as possible.